Welcome to the AT Parenting Survival Podcast, where you get help and guidance through the chaos of parenting a child with anxiety or OCD. This show is for educational purposes and is not intended to replace the guidance of a qualified professional. Here's your host, child therapist, Natasha Daniels.
Well, hello there, and welcome to another episode of the AT Parenting Survival Podcast. We are going to be diving into a fantastic topic today that is hopefully going to fill in some gaps that you might have about fully understanding OCD and the many ways it can show up. And sometimes OCD isn't about a fear. Sometimes OCD is about a feeling. And we've talked about this before. If you've listened to my previous episodes, we've talked about OCD being a feeling of disgust, where the core fear is actually just an overall feeling of disgust. And we've talked about just right OCD, where the overall feeling is it just doesn't feel just right. And part of some presentations of just right OCD is Tourettic OCD. And that is kind of when Tourette's, tics, and OCD merge as one and show up as Tourettic OCD. I wanted to talk about this for a long time, but I wanted to bring in an expert in the field because it's one of those topics that you really need to get someone who understands it fully because it's completely confusing. And when I did the International OCD Foundation BTTI training, I learned about Tourettic OCD and was really impressed with Dr. John Piacentini. And he is a leader in the field, and he is the director of the Child OCD Anxiety and Tic Disorder Program at UCLA. And I invited him to come on to educate us and you on understanding Tourettic OCD better. But before we get started, I do want to thank NoCD for sponsoring this episode. NoCD offers affordable, effective, convenient therapy, and they're available in the US and outside of the US. And you can schedule your free 15-minute consultation to see if NoCD is the right fit for you and your child. Just go to treatmyocd.com. That's treatmyocd.com. I'll leave a link in the show notes. Also, if you want to get educated on OCD, it's really important that you have a full understanding. You can check out my free webinar, 5 Things That Every Parent Raising a Child with OCD Needs to Know. You can find that at natashadaniels.com/OCD webinar. All right, without further ado, here is my interview. Well, I want to welcome Dr. Piacentini to the show. Thank you so much for coming on. I really appreciate it.
No, it's my pleasure. I'm excited to be on this show.
Yeah, I get so many questions about Tourettic OCD, or even just Tourette's OCD and tics. And I really feel like you're the go-to person to talk about this. And I haven't covered this topic at all on the podcast in 5 years of doing this. And so I'm excited that you agreed to come on so we can explore this topic and help parents demystify the presentation of this, the treatment of this, and what people can do. So to jump in, can you talk about just some really basic background for someone who just has no clue about how these interplay, what Tourettic OCD is?
Yeah, absolutely. And the term was initially coined just as a factoid, I guess, by a friend and colleague of mine, Charlie Mansueto, who did some of the very early work on this and published the initial paper back in the early 90s. So it's been recognized for quite a while as being somewhat of a distinct disorder between OCD and Tourette's, although it's not an official diagnosis. We wouldn't call it an official diagnosis. We use the term quite a bit, and it's quite descriptive. But I guess technically it doesn't really exist in medicine.
Yeah, and you see that a lot, that we get these little shorthand names for things that really don't have a DSM home.
Right. So, and let me first just take a couple of seconds. I'm going to define Tourette's and I'm going to define OCD, and then Tourettic OCD will be in the middle, and we can talk about that. Which aspects of each of the other two disorders make it up, because it really is kind of the stepchild of Tourette's and OCD. Mm-hmm. So OCD, as I imagine many of your listeners know, is a disorder characterized by intrusive, unwanted thoughts, feelings, or sensations that can be frightening or uncomfortable. I'm afraid if I touch this, I'm going to get sick and I might die. If I don't um, do something a certain way, then something bad is going to happen. And these thoughts then lead to behaviors or compulsions or rituals that people do to make these bad thoughts go away. If I don't tap 3 times, my brother's going to get sick. If I don't turn in circles 3 times, I'm going to flunk my test. If I don't wash my hands repeatedly, I'm going to get sick from germs. If I don't avoid saying a certain word, nothing bad will happen. So it's really these thoughts or feelings that trigger anxiety or distress, and then doing these discrete behaviors that make those feelings go away. And again, sometimes the relationship is logical. Washing my hands to avoid getting sick is somewhat logical. Tapping 3 times to ensure that I don't flunk my chemistry test, there's not a lot of logic to that. So it's more of an emotional type of a disorder or anxiety disorder. Tourette's is much more of a physical or motor disorder, kind of similar in the basics. So in Tourette's, most individuals with Tourette's is characterized by tics, motor tics and vocal tics. In Tourette's, most individuals will experience what we call a premonitory urge, a sensation, a tightness, a tingling, a need to move a certain part of the body. And that's followed by the tic, which then relieves that urge. And every time I do the tic and relieve the urge, my brain learns that the tic is good because the tic makes that urge go away, makes that bad feeling go away. And so that is kind of reinforced and strengthened over time, this premonitory urge or sensation, and the tic become like almost inseparable. They're joined together, and it becomes almost an automatic relationship. So common tics would be eye blinking is typically what we see in children, the earliest tics, head shaking or head movements, arm jerks, leg jerks, stomach tensing. It can be almost any kind of a physical or motor behavior. And then vocal tics would be sound. So we can just, it could be throat clearing, it could be a loud exhale, a loud inhale, snorting to the point of saying syllables or making sounds, animal noises, even to saying words. And coprolalia is what everybody sees on TV for Tourette, somebody shouting out profanity. So OCD and Tourette's are actually quite parallel because they both involve some kind of unwanted feeling or fear or sensation that then drives the person to do something to make these feelings or sensations go away. Except OCD is more sensory, more emotional. I mean, Tourette's tends to be more like behavioral or sensory. Tourettic OCD looks like OCD because people have to do things in certain patterns or certain ways to make the bad feeling go away. But instead of an anxious thought, it's more of a Tourettic urge. So I have an urge kind of like more like I would have with Tourette's, but I have to engage in doing something a certain way or in a kind of predicted or stereotypic manner. And that's unlike tics. Tics, usually the behaviors are kind of random. So it's really a combination of both. So it could be like sensory OCD in some ways, or it could be almost like compulsive Tourette's would be the way that it goes together.
Yeah, it can get really confusing.
Yeah, I just kind of confuse myself a little bit, so it can be confusing.
No, I think when they overlap, it gets confusing. Let me back up just on a just basic foundational scale. So like separating tics from Tourette. So Tourette's is diagnostically, do you have to have like a vocal tic and a motor tic to have a diagnosis of Tourette's?
Yeah, that's a really great point. So the majority of people with a tic disorder would have what we would call persistent motor tics, tics that are movements or motor behaviors without sounds, like no cursing, none of that other stuff. And that's really common. I just have motor. It's all muscle. It's all basically just doing things. Vocal tics or phonic tics, but vocal tics are making sounds with mouth, like with air coming in or out. So snorting, sniffing, saying words, profanity, those are all vocal tics. And vocal tics are pretty rare in the absence of motor tics. So Tourette disorder is simply somebody with both motor tics, like arms moving, legs moving, head shaking, and vocal tics making sounds. That's all it is. That's what distinguishes it from a motor tic disorder or a vocal tic disorder.
Okay. Yeah, that's good clarity, I think.
Yeah. Okay.
So, because we'll use my daughter as an example. She's got motor and vocal tics. They happen at the same time, but totally unrelated to her OCD. I mean, ironically, she has sensory motor OCD, so who knows?
Yeah.
Related to her bladder, but her vocal tic happens exactly when she does her motor tic. And I think that's when parents get confused is sometimes when I see it kind of smushed together. Like for me, those are separate. I don't see her necessarily having Tourettic OCD. They kind of all go hand in hand. You got tics and you got OCD. But there are parents where the kids are doing things like you described, where it seems tic-like, but there is this compulsive nature to it, or there's a thought behind it too, until it feels just right. So could you give examples of some Tourettic OCD?
Sure. Tourettic OCD, it's usually provoked by some kind of a sensory trigger. Um, and oftentimes this is described as just feeling not right, or it just needs to be a certain way. Something is out of whack. And that might be typically a sensory feeling or some kind of sensation in the body. And what happens then to make that feeling go away, oftentimes the person with Tourettic OCD will need to engage in a repeated behavior over and over to make it feel right. So I don't know, my I have a funny feeling in my shoulder or something. It's a sensation, and I need to do this. Tapping, for example, or moving like this in kind of a stereotypic fashion to make it right. So it's the way it differs from Tourette's is that we oftentimes patients need to do something a specific certain way or a specific number of times.
Yeah.
So really common Tourettic OCD tics would be like tapping or arranging or touching or things in certain number of times.
Yeah, and that makes sense because then I think even OCD therapists have a hard time with Tourettic OCD. Like it gets diagnostically it gets confusing. And so like when we hear, oh, it has to be, 5 times, then we're like, okay, it's not a tic. We're going to treat it purely like OCD, where it's a combination. It's like until it feels just right. Do you see magical thinking attached to this sometimes? Like I have to do it 5 times or something bad will happen.
Sometimes we do see that when patients will say, yes, I know in my mind it has to be 5 times. Other patients will just say, I need to do it until the bad feeling goes away, however many times it is. Usually it's 5, sometimes it's more, sometimes it's less.
And I wonder, is Tourettic OCD like synonymous to just right OCD? Or is it only when it's involving the body?
It's pretty similar, I think, but there is more of a body related component to it. So if I had to repeat something in my mind 5 times, that wouldn't be Tourettic OCD because there's no movement. But
Yeah.
I think it's very similar, very close to that, and it may be even be identical.
Yeah. I think that helps understand it though. Like we're dealing with some sort of like motor movement, you know, when we're smushing together like Tourettic and then OCD.
Yeah.
And I think this is where parents get stumped is then how do you treat this? Because it is just this sensation and it's so different. A lot of the approaches don't seem to work for Tourettic OCD. You certainly can't think your way out, I don't think necessarily of, Tourettic OCD. It's a feeling. So what are some of the evidence-based approaches that you recommend?
Yeah, and you're exactly right that the treatments don't work quite as well as they do for straight OCD or straight Tourette's, because when we're working with patients with Tourette's, we ask them to, if you have an urge to do something, then we ask them to engage in a competing response, would be an opposite behavior. So if I have a tic where I want to thrust my arm out, The idea was when you have that urge would just be to cross your arms and hold them gently against your body so you don't make the movement. And over time, then the urge will dissipate. Usually pretty quickly the urge will pass, and then you don't need to do the tick. Same thing with OCD. If I have a thought that something is dirty and I need to wash my hands, if you refrain from washing your hands, it's going to be difficult. The anxiety will grow, but over a period of time, that feeling will go away and you'll be fine. With Tourettic OCD, these sensations, it tends to be more of a sensory feeling sometimes. And trying to do this, what we would call a competing response for tics or response prevention for OCD, not doing the behavior. It's harder because in Tourettic OCD, the sensations or the bad feelings or thoughts, I'm sorry, the bad sense in Tourettic OCD, the sensations driving the behavior, they don't really dissipate so quickly. They tend to hang on. Mm-hmm. So patients would need to really, or individuals would need to really stay holding this posture of squeezing their arms or whatever it is to not do the behavior for long periods of time, and that's more difficult. The feelings don't really disseminate. The feelings don't really dissipate.
That's interesting. Yeah, and I think it's good for parents and therapists to know, they're not doing something wrong if they're seeing like their child or client like in distress still, that it's going to be harder and it's going to stick around longer, but still the same approach is to do like a replacement behavior almost, like you would do with the tick of like
Right.
holding it, which is totally opposite of what we would do if we're thinking pure OCD. Parents will say, or therapists would even say like, well, we don't want to like move one compulsion to another compulsion. And that's kind of what I explain to parents in my like layman's understanding really of Tourettic OCD is we're going to treat it though like it's a tic and OCD. So you do want that replacement behavior. It's not doing another compulsion. And I think that sometimes is the confusing part that parents are like, what, every other OCD thing that you're telling me about is not doing any behavior. I'm not going to say, well, don't wash. Instead, like really wipe your hands really well on the Clorox wipes. Like I'm not going to replace it with something else that's going to be compulsive. But this one's different, and it's different because it's just, the presentation of it is different.
Yeah, it's a lot trickier with Tourette's, and you bring up a good point because with Tourette's, the competing response, we want it to block any dissipation of the urge. If I have an urge to raise my shoulder, and I raise my other shoulder instead of the one that the tic is telling me to raise, that could still reduce the tic trigger, and that could function like a tic. So we want patients to do the opposite of what the tic is telling them to do. Or in OCD, we want patients to do the opposite or just not to do what the OCD is telling them to do. And in Tourettic OCD, that doesn't really work so well because it can be difficult. It just takes so long for the urge to dissipate.
But that would be the approach. Like if I'm gonna let's like do a concrete example. Can you give an example of like a Tourettic OCD struggle and then like what the action would be?
Yeah, and we still need to block the unwanted behavior in some way. So if the patient with Tourettic OCD has a sensation they need to tap the table 5 times, the key component of treatment is not tapping the table.
Yeah.
Or not tapping it 5 times anyway.
Mm-hmm.
So we still may work with the patients to try to not do the tic, the Tourettic OCD behavior. But it's just going to be a lot more difficult. It's going to take longer for the urge to dissipate. With somebody with Tourette's, I can have them, I need to, push my arm out, for example. Hold your arm in. I mean, after like a minute or even 30 seconds, sometimes the urge goes away. With OCD, sometimes it may take even a few seconds or a minute and the urge goes away. With Tourettic OCD, it may take a lot longer. Mm-hmm. So what we may do with patients when we're starting out is to have them resist for as long as they can. And it may not be that long, and then they give in. And then over time, we build up tolerance where they're able to resist the urge to do the behavior for longer and longer periods of time.
Okay.
And the other things that we do also is we want to really work on the sensory aspects of it, because Tourettic OCD is typically sensory. It's just not just right feeling or there's certain feeling. So we may place patients in situations where they're experiencing that feeling, trying to trigger the feeling and having them see how long they can experience it without giving in. And then over time, as they develop more tolerance and they can go longer without they can manage it for longer and longer periods of time, and ultimately they may be able to gain some control over it.
Yeah, like learning how to just sit with that uncomfortable feeling.
Right.
It's time we put help directly in our kids' hands. Introducing Crushing OCD course for kids and teens.
It was way more helpful than all the other therapy we've ever done because we didn't really know what to do. So we weren't really doing it before. So the course helped to figure out what the exposures are and how to do them.
We're not in therapy and find it really hard to find an ERP trained therapist here. So we're currently with like the public health service, but again, they don't seem to be trained in ERP. It's filled that gap that we don't have that was desperately needed.
This was really well timed for us to use between therapists and to help us get off to a good start with this new practice.
It was easy to use. I was able to do it from my phone or also on the computer.
There's different ages, so there were younger kids, there were teenagers, and so that was really nice too, to have a variety of ages where it wasn't just geared towards younger kids or older kids. It was a nice variety.
It's helpful for our kids to hear it from this third party as opposed to just us saying it.
I really like the offense and defense method. I love working on poking at OCD while it's sleeping. It makes it a little bit easier to do, and it's kind of fun. I'm planning on using it to work on my fear of holding or touching batteries and stuff like that.
So it was really helpful, and I think a lot of other kids would like it. I thought that I was the only one who had worrying about the weather and stuff. And then there was somebody else on there who worried about the same thing, which was really helpful.
Seems less scary to work on stuff now that I've watched this class, and I'm more interested to work on it.
I like trying to do more exposures still, and before I wasn't, I just didn't want to do them.
I've worked on some of my bigger compulsions and been successful.
I realized that it was helpful to do the exposures. Before it was really, really hard. It's still hard, but it's helpful to know that I need to do them.
Before there would be a lot of battles about it, so it is definitely less loggerheads.
Really, really good course and super helpful.
Definitely would recommend this. It's really easy to follow. It's nice bite-sized videos. I really like the worksheets that go along with it, and I think it's really helpful.
To learn more about this course and register your child or teen, go to atparentingsurvivalschool.com.
So we have all these names, not diagnostically, but we label these different OCD themes, sensory motor, just right, symmetry, and they're all just OCD, but it's just a shorthand, I guess, of what type are you dealing with. But it makes me wonder, because you're talking about sensory and senses, and so it can be sometimes a little bit of a just right thing when it's a physical sensation in the body, because you can certainly have just right outside of your body. But then I'm wondering about sensory motor OCD, when people hyperfixate on blinking or swallowing, or I wonder would that be categorized as Tourettic OCD?
That's a really good question, because it can look exactly the same as Tourettic OCD.
Yeah.
In my mind, if I have a patient with OCD that has blinking or swallowing as examples, I want to see what's the cause, what's driving this behavior. And if it's, I'm afraid I'm going to choke, I'm afraid I'm going to get something in my eye and I'm going to go blind, that's more fear-based. So that would sound to me a little bit more like OCD. If the patient says it just doesn't feel right, it just is, I get this weird sensation. There's no fear necessarily. I don't think there's any bad outcome, but I just get this weird feeling that I just can't stand. And it may be I need to do it or I'm going to go crazy, but it's not like a specific fear. Then I would think maybe a little bit more Tourettic OCD.
Yeah, that is interesting. I mean, what I see with sensory motor OCD generally, with the people I've worked with, like in my communities, it's like I need to blink because what if I forget to blink, or what if I stop blinking, or I'm focusing on my blinking, so I feel like they almost want to like override the automatic bodily functions, or what if I don't swallow, or I feel like I haven't swallowed in a while. With the bladder, I feel like it's full. I feel like I need to continually empty that. So it's just senses. But I wonder if that's Tourettic OCD.
Yeah, that's a really good question. It, the thing is, there's such a fine line where this stuff blends together. There is another example. There are some obsessions and some tics that look almost exactly the same.
Yeah.
I need to do this in a certain way. And it's a motor behavior, it's a movement, and I need to do this a certain way because I'm afraid something bad will happen, but it looks exactly like a tic. And again, is that Tourettic OCD? It's not always so clear, but the distinction, yeah, I think the distinction can be hard at times to determine this. And I think the good news is that it probably doesn't matter that much because the treatments are broadly similar, just with the Tourettic OCD type symptoms. You just need to have more patience and go slower. It takes longer to do this. We don't really diagnose people in our clinic with Tourettic OCD. Again, it's not a formal medical diagnosis. So the symptoms that you're talking about, about I need to breathe because if I die, I may forget to breathe. That doesn't sound exactly like Tourettic OCD because there's a cognition, there's a thought, or a rationale. But some of the other things, I need to do things in certain ways because it just feels funny. I mean, we see that in our OCD patients all the time. And we may say, oh, that sounds like a Tourettic OCD symptom, but we would still call them OCD. We would diagnose them with OCD and we just might work on those symptoms a little bit differently, again, with a little more patience.
Yeah. And that is good for people to hear, because if they're like, we're doing everything right and we're not making as much progress as other people, well, it's a little bit more sticky and stubborn.
Right. The other thing to think about with treatment is it's also, we can do some specific sensory work with kids that have these sensory symptoms. It just feels, I can't tolerate this feeling. It just feels odd or not just right. We can do other kinds of experiments with them, like have them be in situations where we make other things not just right. Or we might want to trigger senses, or we might want to put them through some sensory exercises of having them experiencing different textures, for example, or different bodily movements to try to trigger some of these sensory symptoms. And again, we're just basically trying to teach them or help them, their bodies become able to tolerate different types of senses or less comfortable situations. It still is a bit of an exposure therapy.
Yeah. I wonder if you see an overlap with kids with like sensory processing disorder, or if that gets maybe misdiagnosed when it looks like people are.
Yeah, that's a good question. I haven't really thought of that. We see a small number of kids with sensory processing disorders in our clinic. They usually go elsewhere for treatment. They may never make it to us. But I wonder if there's some overlap in the neurocircuitry, the brain circuitry for both of these, just in terms of misinterpreting sensations or not being able to accurately manage or respond to certain sensations.
Because
we have seen. I'm remembering a couple of cases that we have seen. Sorry, I just got a call.
No worries.
Where was I? We have seen a couple of kids. I'm remembering a couple with pretty bad sensory processing disorders, and oftentimes it involves being unable to wear certain articles of clothing, or even any clothing. And or sounds, those are pretty difficult to treat. It takes quite a while, but that would. Sorry, it's my phone. I don't know if you can hear this or not. I think with the sensory processing, issues, it does overlap, I think, quite a bit with Tourettic OCD, and you might even consider that Tourettic OCD would be a subset of sensory processing, although I don't think that's ever been, people don't necessarily consider that, when they're making diagnoses or all. Maybe in occupational therapy, they think it's all the same, and they may be right. And in psychiatry and therapy, we tend to differentiate.
Yeah. Well, and I do see the overlap, or I see like sometimes there's like a need for a differential because you have a child who like won't wear, they can't wear this, they're changing their shirt all the time, or their jeans feel weird. And with sensory processing disorder, if you find that magical like thing that their skin just feels good, like cotton or whatever, or no tags, that tends to satisfy SPD. But with just right OCD, there's never any satisfaction. It's like, no, the shirt will eventually feel bad and they have to keep taking it off and changing it. And I feel like it gets, there's a little overlap there, with sometimes what is something that a child is going to just have to learn how to deal with, very similar to Tourettic OCD, like just learning how to sit with that discomfort, versus sensory processing disorder, which is like finding that magic unicorn of a shoe and, pants, and finding what their skin will like, which is different approaches. And sometimes parents are dealing with both of them.
Yeah, that's a really great point. I like that distinction a lot. One of the other things that we do with the kids, I might have alluded to this a little bit earlier, is in terms of teaching distress tolerance techniques. So, we'll teach them breathing exercises, for example. We'll take them on other types of activities to help them better manage their senses. I've talked about exposure, kind of graduated exposure to situations or to stimuli that are noxious to them, but starting with something very light or very, very small and gradually working our way up. We can do guided imagery with them. We can do other types of additional interventions to just help them learn how to better manage their thoughts or their emotional arousal.
Yeah. Yeah, that's really helpful. I wonder if the medications that you normally look at for OCD are the same that you would commonly prescribe for Tourettic OCD, or is it a little bit different because we're dealing with something a little bit different?
That's a good question. I think it's a little bit trial and error. So we know the medications we use for OCD tend to be similar to the medications we use for anxiety and depression, the selective serotonin reuptake inhibitors, and they tend to work pretty well. For Tourette's, we use a different set of medications, the alpha agonists, and sometimes in more severe cases, we would use the neuroleptic medications or the antipsychotic medications, there's some more recent ones that are that can be a little more tolerable. For Tourettic OCD, I think and again, I'm a psychologist, but I know that the child psychiatrists in my clinic, we tend to experiment a little bit. And sometimes they may use a combination of both. Even with severe OCD, there may be a combination of both OCD and maybe some tic medications, which seem to can be helpful in some cases. I think with the Tourettic, I don't think with Tourettic OCD, I don't believe that there are any psychopharmacologic guidelines. Mm-hmm. I think a lot of it may still be trial and error, but we would oftentimes start with the OCD medications. And then if we're not getting the response that we'd like, our psychiatrist would add maybe some of the Tourettic medications.
Okay, yeah, that's helpful. Would someone dealing with like tics, Tourette's, OCD, would they see a neurologist along with an OCD therapist, or Tourettic OCD? Or is that going to just confuse treatment to be seeing so many people?
Well, I think it depends on the setting. Again, in our clinic, we have a very well-established OCD Tourette clinic that is, I direct it as a psychologist, and I have a medical director as a child psychiatrist. So we're able to manage these cases without the need for a neurologist or other professionals. In some cases, we may call in a neurologist if it's a very complicated situation, or if we want to rule out a potential neurologic disorder. But I think in a lot of places, I think where mental health care isn't as readily available, kids oftentimes present to neurologists. They're present to their pediatricians, and then the pediatrician sends to a neurologist, and then mental health, psychology, or psychiatry may come on after the fact. So it's not necessary to see a neurologist if you have an experienced psychologist or psychiatrist available, unless there are some issues that may raise concern. And any good psychologist or psychiatrist seeing a case with some potential neurologic concerns would hopefully send that out for a referral.
Yeah, definitely. So is your clinic taking patients, or are you guys full?
Oh, we're always taking patients and we're always full. There is a bit of a wait list. We got kind of a long wait list, but we're actually in the process of expanding our clinic with we've had a couple of generous donors that have allowed us to hire some new staff. So we've about tripled the capacity of our clinic over the past 3 years, and we're working to expand it even more. I mean, the need is so great. I think we're seeing about 80 patients a week now.
Wow.
And we could do double that easily. So people should certainly, if they're in our area, Los Angeles, Southern California, people should certainly feel free to reach out to us, because we also, what we try to do for everybody that we can't see, we give community referrals. And there are some.
That is really helpful. I will let people, we'll leave a link in the show notes on how people can reach you and reach your clinic, and even just get resources. If someone lives outside of California, is there a website that kind of gives people resources for that?
There are two really amazing resources that people should be aware of. The first is the International OCD Foundation, or iocdf.org is the website, and they have all sorts of information. They have a referral service, a web page with a list of clinicians that with information about treating OCD and Tourettic OCD. Really great. They have an annual conference, two actually, a live and a virtual, with patients and professionals. I go every year. It's an amazing resource. The other is the Tourette Association of America, and I believe their website is tourette.org. Very similar. On their website, they have a referral service. You can identify clinicians across the country. Tons of information. They also have a conference, so a yearly conference that's live for patients and families and professionals. And these are both really, really amazing resources.
Yeah, I appreciate that. And I will leave those links as well in the show notes.
Good. I'm going to send you a link too for our center, our anxiety center, the Center for Child Anxiety Resilience Education Support at UCLA Cares, which is all sorts of stuff about anxiety, some about OCD and Tourette's as well, if you don't mind putting that up.
Yeah, that would be great. I think any and all resources are super helpful for parents.
Yeah, good.
Well, I appreciate you coming on. This has been really educational. I think it really helps clarify the difference in how Tourettic OCD presents. I appreciate you.
Yeah. And I was even struggling a little bit because it's hard to.
It is hard.
I don't think anybody knows exactly. The boundaries are just, there's no set boundaries.
They're very blurred, but I think we got it as clear as we can.
And that's great. This was really fun. I love doing this stuff. Anytime I'm happy, or to somebody else in my program if you have similar topics in the future. But this was really great.
Yeah, I appreciate it. No, we'll definitely be revisiting these kind of topics again.
Good, great. We'll get to see you.
Well, I hope that you found that interview helpful. He is definitely a wealth of information, and you can check out, if you are in California, check out the Child OCD, Anxiety, and Tic Disorders program at UCLA Semel Institute. I will leave a link in the show notes. It is quite a long link, so I can't tell it to you, but you can go to uclahealth.org, and it's in their website, but I'll leave a direct link to the center, to the clinic, and also to Dr. Piacentini's provider page as well. So you have those extra resources. I hope that you found that helpful. I hope that you find the podcast helpful in general. Don't forget to review it, hit a star, write a review. If you write a review, I'll be reading yours next time. And don't forget to find the sparkle in everything you do. And I'll talk to you again next week. Take care.
Thank you for listening to the AT Parenting Survival Podcast. To get additional support raising a child with anxiety or OCD, visit Natasha's online school of on-demand classes at atparentingsurvivalschool.com.